bringing on a remote team member, a virtual assistant to help your team that's in your practice is one of the best ways that we can help with reducing team burnout. You have to remember that anyone you bring into your practice, whether they're in office or they're remote, they do have to receive training.
All right, we are live for another episode, and today we got Rebecca here, and she's going to be sharing some interesting information with us today that I think will help you reduce your costs. So Rebecca, let's start here. Should dental offices be outsourcing their admin work?
Absolutely. We're bringing on a remote team member, a virtual assistant to help your team that's in your practice is one of the best ways that we can help with reducing team burnout, but also passing along some of those responsibilities that our front desks are doing now that are easily done by someone remote. Some of those repetitive tasks like insurance verification to even answering our phones. Those are things that someone virtually can do to support and help someone in your practice so that they aren't having to be distracted. And they can help with the patients that are in your practice so that they can focus on them, closing those cases, getting the case acceptance, and allowing that virtual assistant to basically be your secret weapon that's in the back office.
So you can definitely do it, and that was going to be my next question, like where should people start? So you think they should start on a lot of the front desk items. One of the big concerns, though, that dental offices have is how do you keep your team in lockstep and keep the quality of everything being the same, right? So this is what keeps dentists up at night, and why people probably say no to this right out of the box usually is, hey, this is going to be somebody else, somewhere else, maybe even a different culture. How do you solve that, or how do you speak to that? I'm sure dentists ask you that a lot. So how do you solve that problem?
Absolutely. That's a great question, and one I definitely want to answer for you and your listeners. So you have to remember that anyone you bring into your practice, whether they're in office or they're remote, they do have to receive training. So this is where that big key component needs to be very well received. You have to be willing and able to train those virtual assistants to a T. So if you don't have SOPs in place, if you don't have procedures or protocols laid out for your practice, this is the time to do it. Being able to train those virtual assistants to how you would like it done in your practice, this is the time to lay them out and train those virtual assistants the way that you want to have it done in your practice. So if you have a way that you want to have your phones answered and questions answered for your patients when they call in, train the virtual assistants. Tell them what you want them to say, how you want to respond to your patients according to your core values, your mission statement, and the culture of your practice. Just like you would need to do if you were bringing someone on board as a new receptionist or a new treatment coordinator in your practice or a new insurance billing person. What's nice about having this virtual assistant be in your practice and be essentially an employee versus a third party is that they are your employee, and you do get to train them to do it exactly the way you want it done. If you want it put, like insurance verifications, right? This is a great task to offboard and give to a virtual assistant because sometimes they have to sit on the phone with insurance companies for a long time. And we don't want someone in our practice who's patient-facing to spend time on the phone, on hold with the insurance company when they can be giving time and attention to the patient that's standing right there in front of them. But doctors don't want to lose those phone calls and opportunities to talk to new patients because that's their return on their investment on their marketing dollars. So when they are talking, whether it's to a new patient on the phone and it's about their insurance and do you take it and blah, 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 we want to be able to answer those questions thoroughly, hang up with that patient, and then get on the phone and verify their insurance with their insurance company. Some offices work a lot in specialty, implants, all on fours, extractions, third wisdom, sedation, sometimes those questions that can't be answered from a portal. with the insurance company. So we want to be able to reach out to the insurance company and get the answers. We want to know that we're taking care of the patient and getting our breakdown benefits correct in our PMS systems, into our practice management software. So in order to do this, this is a great task for the virtual assistant to do. They can call, they can get on the phone. They're happy to sit on hold. They can multitask while they're sitting on hold, just like anyone else in the office. But then they can get the answers to those codes and procedures that we are specific in our practice that may not be on the insurance portal. Then we can have a full breakdown. They can enter it into the PMS system, and their treatment plans are going to be as close to correct as we can with as much information that we can receive from the insurance company.
So tell me a little bit about what you do to help this. So like, I'm trying to think through this as if I'm a doctor. It's like, okay, yeah, this is all great. How do I actually start? Like, how do I actually do this? Walk me through your process of how you actually help people.
Absolutely. Great question. So with my company, and I do coaching for practices, so I'm with Transformational Dental Coaching. Part of what I do is coaching for the practice. We look at all things within the practice. And then the other side of this is I do help practices that are interested in hiring for virtual assistants. We all know, and I know from personal experience, because several years ago when I was working for a multi-location private practice, we decided to go down this route. So we brought on a team of virtual assistants, and essentially we got rid of everybody at our front desk. We had no one sitting at our front desk. Don't necessarily recommend this for everybody. 90% of dentists should not go this route, but it worked for our demographic of patients. We brought them in, they checked in on a kiosk, so on and so forth. But what I learned in this process as their COO was that we had to do very, very good training. We brought them on, and we just did ongoing training. So in this process, we had a very high success rate with our virtual assistants. Our first full year with all 5 of our virtual assistants, our practices, all 3, saw double the production. We reduced our open share time by about 80%, and we reduced our AR, both patient and insurance owing, to under 60 days. It was a huge success. So I know it works. I actually did it, and we loved it. Our virtual assistants, they're still with that company, by the way, same ones, and they're extremely loyal and dedicated. They want to do a really great job for you. They are so determined to do everything you want them to do and to be extremely successful. That's why I love them. That's why I'm such a huge advocate for virtual assistants in any business, but with dental specifically. So part of what I do with my business is I learned that, especially for us, the hardest thing was giving up someone to train them. And so what I do with my business is I'm happy to connect offices with a company that I'm a huge advocate for. I love the way that they help you find the virtual assistants and then their support afterwards. They support the practice. They also support the virtual assistant. They want to make sure that this works, and they want to make sure that everybody has what they need to be successful. I know we've all heard horror stories and how this never worked, but I truly believe it comes down to the training and the onboarding of the virtual assistants for this to be successful for the virtual assistant and for the dental practice. So this is where I'm happy to come in and help. So one of the things that I offer through my business is to come in and be that employee in your practice to help onboard that virtual assistant for a week to you. I want to make that transition even easier for your practice and for your team members. So that's where I come in. I help them, and we get them trained up in that week with your practice on your PMS system, on the platforms that you use. There's so many things that they can do. The biggest question people ask is, how did you double the production? And honestly, the virtual assistants were the reason. They reached out to recare patients that hadn't been in. They reached out to patients that had treatment that was outstanding. and they rebuilt that practice in a way that people just don't seem to have time in the practice. They're so busy. And they really helped to rebuild our practices by reaching out to patients that hadn't been in a while. So there's a lot of wins, and it's just really honestly comes down to that training.
What would you say are some of the red flags of people who aren't ready for outsourcing? People who it's just not going to work for them.
Red flags that they're not ready. If they can't sit down and list out several things that they easily could give to somebody else, someone to help their practice, they probably haven't given enough thought to it. But that's honestly where I'm happy to help you or your management or your front office team to find ways that we can help the practice. The top 3 things that people, when I ask a practice, the front office team, what are the top 3 things you'd love to give away to someone right now that would give you the time you need in the practice to work with your patients first? It's phones, insurance verification and eligibility, and following up on claims. And these are 3 things that virtual assistants can do in a heartbeat to help your practice to grow and start to produce more in 2025.
What are I'm sure you've heard this before, right? So doctors are like, well, I already tried it. It didn't work. What are your thoughts on that?
I can appreciate that. Like I said, I think where that breakdown comes in for a practice that's already tried it and they haven't seen success really comes down to that training, the onboarding, and what did we do to make sure it was successful for the dentist, his practice, and also for the virtual assistants. Doesn't matter what type of a practice you have, it really comes down to how can we help you? How can that virtual assistant help you grow your practice? And some of this comes down to cost and how efficient they are in the practice. So I do want to touch on that. So there's some really great ways to utilize them in ways that we can't, I guess, in the United States with our in-office team. So there's a lot of different ways, but I truly believe it really does come down to training the virtual assistants to what you need them to do, how you want them to follow through, and then doing that continual training as they need it or have questions.
How did you learn all this stuff? Like, how did you learn all the different ins and outs of outsourcing for dental specifically?
Honestly, a lot of it came down to, training my own teams over the last, 20 plus years in dental practices, and how all that works, to then doing my own training of the 5 virtual assistants we had in our office when I was the COO several years ago. And then this is what I've basically been doing the last several years as part of my coaching business as well, is helping teams find that success in utilizing virtual assistants. Unfortunately, insurances aren't paying more for procedures, even though we wish they would. And unfortunately, the cost of living is just going up and up. And we want to pay the people that are in our practice well so they can stay and continue to grow with our practices. But we also need more help and support for those team members, and that's where our virtual assistants can step in and help us.
That's awesome. If people want to find you or reach out and ask you specific questions, what's the best way to get in contact with you?
Absolutely. Thanks for asking. You can find me at my email is Rebecca, REBECCA, at yourtdcoach.com. You can also find me on my website at yourtdcoach.com. I'm more than happy to meet with anybody. You're welcome to schedule a free consultation with me to talk through the needs of your practice and how I best could help you find a virtual assistant that could help you with your specific needs and ask any question you'd like. I know there's probably a bazillion out there right today after this episode. And then I also work with a company for virtual assistants called Reach. And with a specific introduction from me, there will be a discount of $500 off of your first month with your virtual assistants through Reach.
Awesome job. Thanks so much for jumping on today.
Absolutely. Thanks for having me. It's been a pleasure. Thanks, Gary.